Okay. So Jim, please share with us what symptoms you experienced before starting care and the changes you've noticed since you began treatment.
Okay. Before starting the program, I had numbness and tingling in the feet, a lot of discomfort. When I went to bed, I would always lay down and the numbness and tingling would get worse, so much so that within 10 minutes I'd have to get up and walk around to shake it off before I could go back to bed. And that's pretty much the symptoms. Lack of sensitivity to cold, lack of sensitivity to heat, temperature changes, and sore feet all the time.
Okay. And what changes have you noticed since you started care?
The changes have been very impressive. I have no more numbness, no more tingling. And my right foot, which was the better one, as the doctor told me, is got great sensitivity now to heat and to cold. The left foot, he said, which was worse than the right one, is probably about 75% better in terms of heat-cold sensitivity. But again, no numbness, no tingling, and no problems going to bed anymore, sleeping good.
Okay. And how long did it take before you noticed those changes?
The first changes I began to notice after about 2 weeks, maybe for 6 or 7 treatments, and then dramatic improvement about halfway through the program, and then pretty much steady as she goes from there.
Okay. And how do you feel after changing your diet and taking the supplements?
I didn't have to change my diet because I have always been on a diet where I don't do any processed foods, very little sugars, no carbohydrates.
Very good.
I've been on a protein and vegetable diet, so moving to this diet meant eliminating an occasional piece of bread or something, but not a problem.
Awesome.
Supplements were no problem either. That's part of the routine. I don't take any medications whatsoever, no prescription drugs, so I had to change my routine a little bit to remember to take the damn pills. That's about it.
Okay, very good. And what would you share to other patients who might consider the treatment?
Well, it's your health, and not a cheap treatment, but again, you have to consider what it could do for you. I was very impressed in the initial meetings where it said, we treat the underlying cause and not the symptoms. And for in my case at least, it certainly worked out that way. So well worth the effort, well worth the cost, and well worth coming in every day for 30 visits. Thanks.
And what was your favorite part about coming in for treatment?
Resting and relaxing. I always did breathing relaxation exercises during the treatment, which helped the time to pass, and that way I didn't have to watch Fox News.
Okay. Thank you, Jim.
You're welcome.